simple answer is it's government-sponsored health care for seniors and the disabled. First created in 1965, Medicare was designed to provide medical coverage to people on Social Security. It's often confused with Medicaid, which was created to provide medical care for those in poverty, but they're not the same thing. Medicare works a lot like health insurance, except the government is the one reimbursing doctors and hospitals, not a private insurance company. You become eligible for Medicare when you turn 65, if you're medically disabled before age 65, or if you have permanent kidney failure requiring dialysis or a transplant. Medicare is divided into several parts simply known as Part A, Part B, Part C, and Part D.
Right, so that's the nuts and bolts of Medicare, but to help us break it down even further, I'm joined by Toni King. She's the author of the new self-help book, Medicare and Health Insurance Survival Guide, What You Don't Know Will Hurt You. And I gotta tell you, Toni, when I heard I was doing an interview on Medicare today, I thought, ugh.
Kind of blows you away.
Yeah, I mean, it's a lot to sift through. It's a lot of information. So what's the most common mistake you see people make?
The most common mistake that most people make is when they're supposed to get on Medicare, that they don't go down to Social Security and get Part B. Some people think, I don't want to pay the premium because it's $110.50, and if they don't get it at that time, then they're penalized 10% each year. There's different rules, and this is the Medicare New Handbook. So there's rules in here. That's why I wrote the book, so that I make the rules a lot simpler for you.
Now, is it $110 per
month?
Per month. People have to pay.
So if you don't get, there's a 7-month rule. You can get on Part B 3 months before, the month of, and 3 months after. So if you wait past 90 days, then you are penalized 10% each year. You could have had it but didn't. So if someone is retiring and they don't even have Part B because they have company benefits and they don't even know they've got to go down and get B, they're penalized each year. It goes all the way back to the day that they turn 65.
What is not covered under A? You tell a story of a man who you met.
Well, that's what happened to him. He called Social Security. The reason why I wrote the book is because people are calling the Medicare and they're calling Social Security and they're getting telemarketing companies. They're getting a big telemarketing room. And when Mr. Davis called Social Security, they told him don't get B because he had retirement benefits, but he wasn't working. And Social Security looks for the work. And because he wasn't working, he was penalized 10%. And when he went in the next month and got a stent put in his heart, he had to pay 100% because he didn't have B. A is hospital. B is medical. B is everything. Everything. It's outpatient surgery, MRIs, CAT scans, sonograms, doctor, surgery, anything.
That is so important.
Yeah.
I'm just defining the two of those. What about the other parts?
You got Part C, which is your Advantage plans, and that's what they're doing enrollments. They start their enrollments November 15th through December 31st, and that's in the book here, in your Medicare New Handbook. But one thing they've done with the Medicare New Handbook is this year they've got a disclaimer saying that they don't know what the new numbers are going to be for next year. So that's important. Anybody who gets this book, the numbers that you got in the back of it are this year's numbers, not next year's.
Not next year's.
But for the enrollment for Part C, it's from November 15th through December 31st. They can enroll in either an Advantage plan or a prescription drug plan. And then after January, there's a new rule that's coming in. You have 45 days. If you don't like what plan you get on, then you can get off of it within that 45 days and go to original Medicare.
Great. So thanks for breaking that down for us, Toni. And again, if you want to get a hold of Toni's book, we're going to link her website to our website. So go to myfoxhouston.com and click on the As Seen on TV tab. And again, you'll find a link to
they can call me. If anybody's got a problem, they can call me on my cell phone, which is 281.
And we can't put that number on television, but I understand that. But we will make sure that they get in contact with you. All right. Thanks so much, Toni. I know people out there don't have pieces of paper to scribble down the number quickly, so we'll make sure we do.